volumes or not?
Volume, doctor, it's sometimes normal, sometimes increased.
All right. And is it associated with any abdominal pain beside the pain you have described?
No, doctor.
All right. Have you ever noticed that your tummy pain gets relief after passage of these stools?
No.
All right. Uh, uh, does these stool easily flush?
Doctor, you can see me in the chat box in the WhatsApp group. Here I am in front of you. Just a minute. Just a minute. Something is wrong. Okay, you continue. I will try something else.
Yeah.
Yes, doctor,
All right.
continue.
Your stools easily flush or they stick on the commode?
Sometimes it's very difficult to flush, doctor.
All right. And have you noticed any frothiness in your stool?
No.
Okay. Does your condition associated with any temperature changes?
Temperature, no.
Any weight changes?
Um, yes, I got a little bit weight, doctor. Yes, I put on weight a little bit.
You have gained weight.
Yes.
All right. And how much have you noticed?
Doctor, I don't know exactly how much, but I feel that I put on weight a little bit.
Okay. Do you have any weather preferences?
No, doctor. You can see me in the chat
Any
box now.
any lumps or bumps in your body?
No.
So there is no picture in the chart.
In the chat box in the WhatsApp group, sorry. Can you see me now?
Yes. Do you
Yes.
have any lumps or bumps in any part of your body?
No.
Any mood changes?
No, doctor.
Any appetite changes?
No.
All right. So, do you have any joint pain in any part of your body?
No.
Any difficulty in getting up from the sitting position?
No, doctor.
All right. Okay. Do you have any rash, pigment, or spot in any part of your body?
No, doctor. I'm going not have a rash. Actually, skin. I think that my skin is getting thicker and thicker day by day. I don't know why this is happening with me.
All right. Do you have any headache?
Yes, doctor. Sometimes. Yes, you're right.
You have headache. Okay. So, do you have any vision problem?
I didn't notice any vision problem actually.
Have you ever noticed that you get bumped into the
No.
All right. Do you have any speech differences?
Sorry.
Any speaking problem?
No.
All right. All right. Do you have any waterworks issue?
Sometimes yes, doctor. You're right. You're a very good doctor. Sometimes I'm feeling that I'm passing too much water.
You are passing too much water. And have you ever noticed any passage of stone or anything?
No.
Okay. Any frothiness in your urine?
No.
Okay. All right. Do you have any issues with your any weakness in any part of your body?
No, doctor. Doctor, would you
Any
like to
change of
examine me? It's the 11th month now.
okay, I'll going to examine you. Wait a second. Do you have any shortness of breath,
No, doctor.
any chest pain or cough?
No.
Okay, so I would like to examine you. Would that be okay for you?
Yes, yes, sure, doctor. What do you want to look for?
First of all, I would like to see the general look of the patient.
Okay.
And so the
Patient is
patient is
tall. Patient is tall, and his hands are enlarged.
all right. Um, okay. And how about the hands?
Hands are sweaty, and their skin is thicker than usual.
All right. So is there any nail changes?
No,
Um, all right. And what about the pulse?
pulse is regular, normal.
All right. And what about the blood pressure?
Blood pressure little bit on higher side, 140 or 90.
All right. Um, does the patient has any vision problem? Can you see me or my face?
Yes, yes. My eyes are good. Patient
All
can
right.
see you.
All right. Do you have any issue with your vision?
No.
All right. Okay. Can you please open your mouth?
What do you want to see?
I would like to see the tongue.
For
Any indentation is there?
enlarged,
All right. Okay. And what about the teeth?
normal.
All right. All right. And how about the neck? Is there any swelling in front of the neck?
There is a discoloration of the neck, and there is few skin tags also.
All right. Okay. Then I would like to auscultate the chest for any cardiomegaly or anything.
Chest is normal.
All right. And the abdominal examination to see any visceromegaly
Uh, any visceromegaly, and what else you want to see?
and any mass in any part of the
No,
abdomen.
no, no. You cannot feel any muscle.
All right. And or all right. So, and what about the pedal edema?
No pedal edema. 2 minutes left.
Okay. So, Mr. John, can you please? I would like to ask some personal questions from you. Would it be okay for you?
Yes, doctor, sure, please.
All right. So, do you smoke?
No,
Or do you drink?
no, doctor.
All right. And what do you do for a living?
I'm a taxi driver, doctor.
You're a taxi driver. All right. And have you ever used any illicit or recreational drugs? Hello.
Yes, sir. Sorry, sorry. You
Have you
continue,
used
doctor.
any illicit or recreational drugs?
No,
All right. And do you have any long-term sexual partner?
no,
All right. Any casual partners?
no, doctor. 1 minute left.
All right. Do you have any concern?
Yes, doctor. I'm very interested to know what's going on with me.
Yes. I appreciate your concern, Mr. John. Actually, you have been suffering from a condition known as acromegaly, and some other conditions is also involved in this state. Actually, your gland in your brain is not functioning properly and is secreting some hormones excessively. That's why you are
Mhm.
having this problem. And beside this, you are also have some issue with your tummy gland, and that is getting
Mhm.
some enlargement and secreting more acid than usual. So that's why you are having the stomach pain as well, and the loose stools associated with it. Are you getting my point?
Yes, doctor. I'm getting, but it's a curable condition, doctor.
I'm sorry, it is not a curable condition, but we'll try to help you out in this regard. We'll run some investigation, and we'll involve the gland doctors and other special nurses. And to some extent, it is curable, and to some extent, it's not. Would it be okay?
Okay, doctor. Time up. Yes, it is okay for me. Your time has up, but I have another concern. My children will get the similar condition also in future.
Uh, that I don't know, sir.
Sorry?
I don't know about it.
Okay, okay, doctor. Okay, Dr. Kurat, please present your case.
So I have taken the history of a 45-year-old gentleman named John. presented to us with two epigastric pain for 2 weeks, and he has past history of recurrent peptic ulcer disease. Um, his pain radiates towards back and is associated with loose stool, which are voluminous and difficult to flush. And associated with this, he has no past medical or family history and no long-term history. He also has a headache associated with it and some enlargement of the body part. So this is,
Okay. So, how you will go investigate this case?
I will send some baseline, complete blood picture to see the hemoglobin level and the other
Okay.
parameters of the body, especially the total TLC count. We'll go for the inflammatory marker ESR and CRP, and we'll go for serum electrolytes, calcium level, and
Okay.
we'll also go for renal function test,
Okay.
some stool complete examination for his loose stool. We'll also go for ultrasound abdomen and CT scan brain, MRI brain to
Okay.
rule out why the patient has headache. And we'll also some genetic testing
Okay.
and
Uh, yes.
and insulin-like growth factors and some gastrin levels.
Okay. What else?
That's it.
Would you like to perform the endoscopy or something like that? Because the patient is
Yes,
suffering from epigastric pain.
yes. After these testing, I will go for the endoscopy to rule out the local condition.
Okay. Would you like to do the pituitary profile also?
Yes. Um, yes, I should have mentioned that, but I have mentioned that in gastrin levels, insulin-like growth factors, and all the parameters of pituitary gland.
Okay. So, how you will manage this case?
First of all, I will reassure the patient with the condition, underlying condition, its diagnosis, treatment prognosis, and complications. Will involve the endocrinologist, will involve the gastroenterologist, and will involve the special nurses, will provide social care to the patient.
And is there any other mode of treatment, about this condition?
Yes, I will also involve the uh, brain doctor,
Sorry?
brain doctors for surgery.
Okay. Any pharmacological treatment?
Yes, after discussion with the team, we'll start patient on some medication to reduce the size of the tumor, and we'll then go for surgical treatment. Like we'll go for the dopamine agonist like bromocriptine, carbapenem, and if patient does not respond over, we go for the octreotide level, and
Okay.
patient has decision, then we'll go for the pegloticase.
Okay. Wonderful. Time up. So, what's your diagnosis at the moment?
Um, After taking the whole history of the patient, my first the differential was men one,
Hmm.
and with feature involving the Zeringer elephants, and the patient has acromegaly features
Okay.
and
Good.
the
Well done.
problem with water works as well.
Okay.
And secondly,
Very well
I
done.
my second differential was esophagitis.
Oh, your second differential?
Was esophagitis.
Sorry, your voice is not clear.
Esophagitis.
Esophagitis. Okay. And third?
I didn't make that.
Okay. Thank you, Dr. Kurat. You have performed very well. What do you think? How this was from your side?
Sir, according to my assessment, my performance was not good because
Okay.
I picked up the diagnosis very late, and most of the things I picked up on examination, and
Mm-hmm.
then I got confused in midwhile and have missed so many things whilst performing it. So it was not that good that I was expecting it to go.
Okay. Which part of your history went uh, very long that consumed too much work and you were unable to pick the diagnosis and you missed a few concerns of this patient? That was a very important point, actually.
Yes, actually, I was I initiated it not well. My pace was not made up in the start.
Okay. By calculating your overall today's performance, physical examination was good, and identifying physical signs are also good. I was expecting these four, five signs, but need to add one more thing. You need to palpate at least neck. Okay.
Okay.
Communication clinical skills were absolutely good. You were right. You took a history, relevant, and differential diagnosis were also fine. Clinical judgment were also fine, which was not compromised at all. Managing patient concerns, that is my basic concern actually.
Mm.
So you have to spare few minutes for at least these patients concern, and patient welfare was also fine. So by put together all this, I think you can score easily in this case. Whatever the performance you think about yourself, it's 23, 24 marks you can easily obtain from this case. Actually, let's start the discussion. This case was a case of peptic ulcer disease, and 40 years old, 45 years old male. This case came in Lahore Center in the previous diet. So outside the station, when given card to the student, written what there, 45 years old male having a 2 weeks history of peptic ulcer disease, and he is having also recurrent peptic ulcer disease for which he was taking omeprazole, and now he came to you, take a history, relevant examination, and address his concerns. So, Dr. Kurat, what was your first thought in this case? Recurrent peptic ulcer disease. Always
Uh, my,
think,
my first thought was gastrinoma in this case,
yes,
and
gastro.
second
So,
was pancreatic, the chronic pancreatitis.
recurrent acute pancreatitis. Very good. So, once you had a differential diagnosis, so your history must be focused about this diagnosis. And one more thing, when you are dealing with the endocrine in PACES exam, especially, don't take it for granted that it will be a single disease. Always try to relate with other diseases, like gastrinoma is associated with other diseases, for example, men. So the key point was missing in this case. The message what I want to convey to you, whenever you are in exam, PACES exam, after ODPARA or even after an introduction, especially in Pakistan and India and Bangladesh, they are not keeping their real patients. So the patient is lying in a couch in a side to you. So whenever you finish your introduction, just ask the surrogate and examiners, sir, I want to see the patient. Just stand up, go take a look of the patient, just greet, hello, assalamu alaikum. And my name is Dr. Azhar or Dr. Kurat. Are you feeling well or cold, like this, to make a communication between you and him? Take a look and come back just. And the examiners are not, concerned about that, what you are going to do. It's very, very good for you if you stand up and take the look of the patient. If you see this patient, Dr. Korat, earlier, for example, after introduction, what was your thinking at that time?
I would have picked that.
Yes, this message I want to convey all of you. Whenever you are sitting the exam, Dr. Kurat mentioned very right. If you see this patient, acromegaly, large hand, long face, So your brain automatically directed towards the MEN1. So you should take the history of pituitary as did by Dr. Korat. Then calcium. So patient came with epigastric pain. You should start with the typical pain, OD para. She did very well. She did onset, duration, progression, aggravating and relieving factors. Then association, she tried to rule out some diseases related to this disease, acid taste in mouth, epigastric pain, referred pain, pancreatitis, and again jaundice, diarrhea. I gave a history of diarrhea also. It's a part of this gastrinoma. Then immediately move to the general question. General question is wafers we are usually using. I use in my exams mnemonic wafers. W for weight changes, A for anorexia, F for fever, F for fatigue, I for itching, R for rash, R for racing in the heart, and triple S, sleep, snore, and sweat. If you don't have time, especially in Dr. Kurat's case, she did not have enough time to screen a systemic review from head to toe. So ask these few questions, 10 or 12, make an habit. So you almost you can screen your whole body. After this, come to the this Pam Fosak past medical history. She missed a very important history. I was waiting that she would ask about the family history. If she asked me about the family history, definitely I was ready to give a history of my mother's some thyroid problem or parathyroid neck cancers or something like that. Right. Uh, my voice is clear,
Yes, sir.
Dr. Kurat. Can you hear me?
Yes, sir. Your voice is clear.
Yes. Then come to the past medical history. So past medical history was given already. He's having a peptic ulcer disease. Then family history, occupation. She asked me, but she need to address my concerns here. She at least asked me to stop driving or to concern with the DVLA. She didn't ask me even impact on the life. So how these symptoms are impacting on my life. Then social history, she managed very well, but in the last minute, but at least she asked. RCP didn't demand you anything in the sequence. If you forget something in the beginning, you can ask in the last. If you forget in the last something, something is in your format in the last ending of your history, you can ask in the first half, first few minutes in the history. That's also acceptable. So you can shuffle your scheme, you can shuffle your questions according to the case. She managed very well. Then come to the clinical judgment. She picked up this case very well. So what are the investigation for MEN1? These are the baseline investigations: CBC, ESR, CRP, liver function test, renal function test, like serum electrolytes, like always. And the specific tests are these are she mentioned calcium, but I want to add a PTH also. Then fasting gastrin levels, prolactin levels for pituitary tumor, chromogranin A levels for neuroendocrine tumors, octoroid scan, then genetic testing also, endoscopy with biopsy because the case was epigastric pain, then pituitary MRI, pituitary profile, ultrasound abdomen, even a endoscopic ultrasound, then CTR MRI of the abdomen to localize the lesions. Coming to the management plan, so always mention like Dr. Kurat has mentioned, two types of managements: non-pharmacological and pharmacological management. Non-pharmacological management, your opening sentence must be a fixed for all cases: patient education and counseling, nutritional support, then psychological supports. Why? Because patient having a problem for last 1 year. So if there is any chronic condition you are facing in the RCP exam, just mention in the psychological support. Then dietary modifications, nursing care, If patient has some disability not related to this case, I'm going to generalize the non-pharmacological management. Then add few supports also again. Coming to the pharmacological treatment in the MEN-1, so there are two types of management again.
रहीम इधर जाना है, इधर.
Medications, medical management and surgical management. Mostly, eventually all patients need to have surgery, resection of this tumor. And we can give patients trial of proton pump inhibitors with the high doses. And in the resistant cases, if surgery is not able to perform, patient is not fit for condition, then we are giving him some this somatostatins analogs. So this what you can face in exams, MEN-1. I'm again going to repeat, whenever you are facing a case of endocrine in PACES exam, don't think a single disease, make a habit to correlate with the other diseases, especially in endocrine, like MEN-1, MEN-2, APS, APS2, and thyroid problems. So if anyone have any question, you can raise the question. I have finished this case from my side.
Sir, can you please repeat that wafer mnemonic?
Yes, yes. Dr. Kurat, actually, the format is very important here. Your introduction was very impressive. You came, hello, I am talking with the Mr. John. Whenever you finished your just introduction, try to grab the past medical history at the top, and you will have a big idea and great idea to deal what I'm going to deal with. Before proceeding further, I would like to ask few questions, Mr. John. Okay. Do you have any medical diagnosed condition which I should be aware of? This paragraph you can use whenever you finish your introduction, take a past medical history, then go to the presenting complaint. Okay. Then OD para. Whenever you finish the OD para, you have rule out your differential diagnosis. Immediately, don't go the systemic review. Come to the wafers first. Wafers, W for weight changes, A for anorexia, F for fatigue, F for fever, night sweats, lumps and bumps. 3 questions. Then itching. Do you have any itching in any part of the body? No. Then R for rash. Is there any rash? R for racing in the heart. So look at your screening here, endocrine. You are screening here dermatology. You are screening here rheumatology. You are screening here even CVS system, racing in the heart, and thyrotoxicosis. Then triple S. What about your sleep? S for sleep. Then snore. Do you snore at night? Because RCP is very, very, tricky exam. Most of the cases, they are related to OSA. So don't miss this diagnosis ever in your history. So make a habit, take a question. Ask always about the snoring. Do you snore at night? Yes, doctor. So what about your sleep? You are sleeping most of the time in the daytimes? Yes, doctor, or no, doctor. Then last, as for sweating, do you sweat more than usual? So this mnemonic you can use in a generalized general questions. Dr. Kurat. Is that clear to you?
Yes, sir. And thank you so much for such detailed explanation.
Dr. Kurat, I would suggest you please manage your time early. Whenever the patient examiner is giving you clue, this is a clue, very big clue. 2 minutes remaining. Forget about any history, leave about any examination, just ask a question. What do you have any concerns? Because concerns have maximum marks. You have first of all, this is a separate entity of your skill, managing patient concerns. If you miss your concerns, you can miss this session only because of these concerns, not by your history. History is only 4 marks. Why you are wasting your too much time there? Take a relevant history in sharp way, then come to the past medical history, physical examination, do a physical examination, come to what's your concerns? Last 2 minutes, what's your concern? Doctor, what's going on with me? Give him a detail. You give very good detail about the disease. So even you didn't know about this genetic testing, will my children will get this disease? You said, I'm sorry, I am not able to answer you at the moment, but I will give you later on. That's very well. This cannot affect your score on managing concerns. If you give a wrong information, that can affect negatively and impact on your this skills. So you can lose this skill in exam.
Okay.
Dr. Kurat, try to manage your time for concerns. Always, whenever examiner giving you indication, 2 minutes left, go to the concern directly. Leave your examination, leave your history, whatever you have, whatever you're doing, go and ask. If you're managing the concern, you are in the safe zone, because concern is a separate skill. Taking history is a separate skill. Examination is a separate skill. Then clinical judgment, how you are going to investigate, and management plan. You did very well. I can give you 100% marks of this skill. Okay. Differential diagnosis, I can give you 100% marks. Your differential diagnosis is 100% right. So 4 plus 4, 8. 4 history, 12. Physical examination, you did very well, 16. Okay. Welfare, again 24 marks, 20. So you reach to the 20 marks. Where you are losing your marks in this case? In the concerns.
All right.
So you are thinking that you did well, so you are losing this case, you will fail this. No, never. Still you are eligible to get 24 marks. But I wanted from you to get 28 marks in this case. We are here all sitting together. What the benefit of this? To give you an idea, which I have experienced in exams, how I prepared for this exam. We were targeting the skills rather than the case. History skill finished. Okay. Examination skill finished. Come to the concern finished. Now come to the clinical judgment, finished. Patient, you are very, very, very good in patient welfare. So it's very easy. If you are going to manage your time in your exam, you will get 28 out of 28.
Inshallah.
Thank you so much. Is there any question from anyone regarding this case?
Yes, sir. If the case is acromegaly and
Yes.
he is having other comorbidity like hypertension, diabetes, should we ask them initially in negriomas initial at the time of biodata?
Yes, doctor. Actually, let me elaborate in a different way. When you finish the introduction, just ask, do you have any past medical history? He will mention you, okay, doctor, I have a diabetes. For how long? For 10 years. Hypertension for 3 years. Okay. We will discuss about later on. When you go to the past medical history, just take a small history of this. What you are taking for your hypertension? Doctor, I'm taking lisinopril. And how often you are using this medicine? And what's your control? Finish. Come to the diabetes. For how long you having? So take the duration. Okay. Medications, compliance, and is there any complication or not? If this disease is relevant to your case, okay, then you will connect this diabetes or hypertension to the case, and you will give a detailed history in your explanation to the examiner. Otherwise, you will just mention my patient is normotensive or hypertensive and diabetic for last 10 years. He is taking insulin for 2 years. His good compliance is very good. His control is like this, and last HbA1c was 6.5 or 4.5. It's relevant to your case. I cannot give you any guarantee. So what will be the case? It is associated with your current symptoms or not. But this is a way how you can connect, how you can take past medical history and use them in your explanation or when you are going to present your case.
Okay, and sir, what are differential diagnosis?
Yes.
And what are common differential diagnoses in the case of acromegaly? If we want to elaborate?
Differential diagnosis common, which I think you can use a Marfan syndrome. Okay, tall, heighted person, and another condition. Dr. Kura, do you remember any other condition? Is something anemia, is some kind of, I don't remember at the moment.
And sir, if patient acromegaly definitely have some other comorbidity like CA colon, and should we ask all other comorbidities as well? We should screen for them.
Actually, acromegaly and colorectal carcinoma is severe association. Eventually, acromegalic patient will develop colorectal carcinoma. You should ask, as did very well by Dr. Korat, do you have any tummy pain or any problem with the bowel works? Any bleeding? So I especially stressed on the examination, what do you want to look for in the abdomen? She said visceromegaly and mass. Why? Because acromegaly is associated with what? Colorectal carcinoma. So you have to examine the abdomen also.
Yes. And also we should ask about men's other point, men's one's question.
Yes.
Like hyperparathyroidism.
Yeah, exactly.
Yes.
Like a calcemia.
Yes, she screened very well. She asked me about the depression, waterworks, then renal stones, and about constipation, mood changes.
Yes.
She was screening at that time. And she was also
Sir,
screening.
last question.
Yes.
Last question. Sorry to disturb you, sir. What should be the scheme of examination in the case of acromegaly, in short cases as well as in long cases?
Okay.
What system in long cases and what in short cases?
Okay. Let me give an answer. If you have a case of acromegaly, depend on which organ they are targeting. They are targeting pituitary initially, neck, or abdomen. If abdomen, like in this case, you will start your examination. The rule of thumb, make an habit, general physical examination, always first. This will play a role of icebreaker. You will take your time during physical examination and prepare your next step in your brain. In the physical examination regarding this case, you will find what? Hand size, doughy feelings, sweaty, greasy skin. Come to the blood pressure, high blood pressure, prognathism, interdental space increase, large tongue, large lips, large nose, supraorbital fissures are enlarged, and there is an increased wrinkling of the forehead. Okay, come to the neck. 3 points you can just examine. Acanthosis nigricans, hyperpigmentation there will be. There might be a skin tags. You can find gynecomastia in this patient. You can check spinal tenderness, abdomen, palpate for the visceromegaly or any abdominal mass, and go for the shoe size. This is more than sufficient. By telling all these findings, maybe it's a time consuming, but when you are performing this, it hardly take 1.5 minutes, because all findings are what? Visual. You're not going to perform anything. You're taking a look. You're taking a look on the hands, skin, you can feel on skin. Just offer a blood pressure. Dr. Kurat, you have missed the fundoscopy offering also that time. Just our fundoscopy also. When you are, yes, extraocular movements, perimetry, extraocular movements, perimetry, and offer fundoscopy in this case.
Proximal muscle weakness as well.
Proximal muscle weakness also. So this might be your examination. You can perform it in 2 to 3 minutes, more than sufficient time for this exam. But always don't go and expose the patient. Take a permission from examiner. Always what you're going to do, just inform the examiner in the real exam. Sir, I want to expose the patient. Oh, he will give you permission, go or not. I want to do the fundoscopy. Okay, doctor, leave it. What do you want to see? I want to see the raise pressure. Pressure is normal. For example, I want to palpate the abdomen. No need to palpate. Abdomen is soft. They will giving you direction. They will giving you a clues. What is relevant to you or not? They are, you know, they are what I can say. They are time saving. They are these guys. Examiners are time saving persons there. If you are not going in the right direction, they will bring you in the right direction. There are separate and many myths in the world that examiners are not good, examiners are like this and that. No, they are very good. They are cooperative. They are sitting there to pass you. I can bet. It's my personal experience. I and my lot of friends, they have passed with me. They have a similar experience. They are very, very friendly atmosphere. Just you need, doctor. Actually, be a basic person. Don't go in the deep. Be superficial. You definitely pass this exam in the first attempt. Work on your skills. You will pass the exam. Dr. Iqbal, did you get your answer of physical examination?
Thank you. Thank you, sir. Actually, accidentally, I attended acromegaly patient today. I've never seen it before, and I attended it today. OPD, journal OPD.
I will share a scheme how to present a patient of acromegaly.
Yes, sir. And that time there was
In a short case, if you find it's rare, it's very rare. It's
yes, sir. I was
sorry.
not thinking about MEN-1. I just learned it from your lecture right now, and I remembered. Yes, it is related, associated with MEN-1. So thank you, sir. It was very nice class.
Dr. Iqbal, my always concerns are to touch those cases which are irrelevant, which we are not usual facing in the practice, and we are facing in the exams. So I'm trying to give you a message. Please don't forget this area. This area is very important because RCP loves. Just you calculate the exam and you will find your answer. Look, you have a cardiovascular in the short case, right? Neurology in the short case, respiratory in short case, abdomen in short case. So two systems remaining behind, three systems: endocrine, rheumatology, hematology. So expect your most of the cases, clinical consultations from these specialties. They want to check from all your specialties. Four, they are taking your concepts in the short cases. Two long consultations, either 90 or 95%, they will touch your endocrine or rheumatology. Remember, these were my words. RCP total exam is calculation, really. It's my personal experience. So calculate your abilities, calculate your physical examination, calculate your time, work on your skills, not books. Books will take you far, very far from the exam. Take a relevant book, short book. I would suggest you to take only Al-Roq book. And for the last days, cases for patients to revise. Is that fine?
Yes.
Good. Any question from anyone? Dr. Iqbal, we are finished?
Yes, sir. Thank you.
You are welcome, Dr. Iqbal. If there is no question, then I'm going to end this meeting today. Thank you so much, all of you. And I will come day after tomorrow or tomorrow. I will inform you and will bring you a recent examination case. And that will be a wonderful case. And Dr. Kurat, if you are there, thank you so much. Okay, good night. Allah Hafiz. Assalamu alaikum to all.